Nicotine use disorder is one of the serious addictions in India and all over the world. It is reported that a person is able to quit most of the harmful substances but not tobacco. Now, according to GAT 1617, that is the Global Adult Tobacco Survey, almost 28.6% of adults consume tobacco, either smoked form or smokeless form. Now, apart from a certain neurochemical changes which occur in your brain because of nicotine, there are certain factors which act as like a maintaining factor, or in some cases even lead to enhancement of that nicotine addiction. What are these factors? They kind of serve as trigger factors, we can say. So there are three such important factors which lead to a nicotine addiction. First is your company. One needs to mind your company. It is observed that most of the people tend to smoke or chew tobacco or even drink alcohols in social gatherings. Now, be it office meetings, after office parties, or even tea breaks. It that constant visual appearance of tobacco or being in that smoked zone makes it even more difficult for that person to quit tobacco, even if he or she seriously wants to do that. Second is internalizing factors. Now, what are internalizing factors? Well, these are nothing but there are certain qualities which are inherent to that person. For example, a person may be very inherently uh, short tempered, or someone who is very, very impulsive by nature, or someone who's not able to cope up with stress or tends to take stress very easily. So, in such situations, tobacco or nicotine addiction serves as a comfort zone. That person goes back to his addiction habits, and it acts as a kind of relief way or an escape way to bypass these emotions which that person is not able to handle or manage effectively. Now, the third is externalizing factors. Now, these factors are outside a person, or maybe a certain family disputes going on, or that constant fights between a husband and a wife, a child and a parent, or some major financial crisis, or certain office atmosphere. Now these act as like natural stressors, and that person goes back again to his original comfort zone, that is smoking, or any of the smokeless tobaccos. And these tobacco addictions or nicotine addiction kind of make that person happy, gives a sense of relief from such situations. So, what does these three trigger points suggest? First is the company. So, if a person is seriously trying to quit tobacco, he or she has to, stay away from such company, or that constant visual sight of tobacco. That constant being in that zone makes it even more difficult to quit. Now, second is the internalizing qualities. Now, these may not be irreplaceable, but a person can definitely try to control or manage their emotions. Now, there are certain relaxation techniques, or there are certain coping mechanisms which help that person to bypass their emotions effectively. Now, third is the externalizing factors. Now, these factors are honestly not in our hands, but again, there are certain mechanisms, there are certain tips and tricks which your doctor or a therapist will help you or guide you to, how to effectively deal with such situations. Now, these factors are not the only one. Now, there is like a detailed counseling chart or a case history chart which a person has to go through or has to fill when that person is counseled for tobacco cessation. But these are most important ones which one has to know if they are very serious about quitting the tobacco.